Okay, good evening, everyone. And thank you for joining us in this session, which is titled Air Stories from Us. We had a wonderful plenary in the afternoon, and you heard from Dr. Marianera, Dr. Arvind, Kumar, and Owen about just the different dimensions of the health impacts of air pollution and how we tell our stories. This session is designed to continue that conversation, build on that conversation with a few more experts as panelists. And we are hoping that through the presentation, the videos that you will see, and the conversations, we would be able to have a deeper engagement on the issue around air pollution and health. This is a 90-minute session. We've already done with 11 minutes, but we're really hoping that this session will be able to, will help you deepen your perspectives and give you ideas of communicating air pollution and health impact in different ways. I would like to call my panelists. Actually, we are starting with a shortcut of the BBC documentary that Owen has directed, which is Under Poison Skies. That's about a 14-minute documentary, the cut that we are going to show. After that, I will invite my panelists to the stage. So can we have the film, please? Sorry. Owen, you want to say something?
Okay, yes. Yeah. So this is a very short version of our Under Poison Skies film. As I mentioned in my speech earlier, the protagonist who's at the center of this shorter version as well, and as actually narrates it, he sadly died a year ago, almost to the day, from his cancer, which is very likely caused by the pollution from flaring. Just to give that context, which obviously makes it all the more tragic, really. But yeah, thank you for watching.
Thank you, and maybe have the film, please. Thank you.
هي في ديوار من جنوب العراق في المكان اللي يأذن فيه اللي يشوفه كل يوم من أمام بيته. الآية هذا قالها
نبهاية مرة أنت ضعيف.
لما كان عمري 15 سنة أصبت بمرض سرطان الدم، وهو سرطان يسببه مركب البنزين.
هاي بيها والله أيام أخي أيام كارثة شو شلون صار.
دكتور شكري الخبير البيئي المحلي أخبرني أن البنزين يأتي من انبعاثات غاز الشعلات.
عندما يتم استخراج النفط، الغاز الطبيعي راح يصعد معاه إلى السطح. طبعا بالإمكان استثمار هذا الغاز لأغراض شتى، ولكننا في العراق نحن نحرق هذا الغاز، وخلال عملية الحرق هذه تنبعث كميات هائلة من المواد الكيميائية السامة المضرة بالصحة، ومن أخطرها مركب البنزين.
ما نعرف كمية البنزين في الهواء بالعراق. قناة BBC عربي مع الدكتور شكري يقومون بقياس مستويات التلوث في المناطق القريبة من الحقول النفطية.
عينة بول ودي شوية وتجيبه هيك تقريبا نص. اوكي وتعال جيب لي ودي شوية وتجيبه حبيبي.
وبموافقة الأهالي يقوم الدكتور شكري بجمع عينات أدرار من 52 طفل يعيشون بالقرب من الشعلات لفحص مستويات المواد الكيميائية المرتبطة بالسرطان.
ما شاء الله تعرف مسلم.
حكي بيناتنا حتى عندنا بالبيض ضامن بعد ذاك.
نعم والله.
فاطمة عمرها 13 سنة وهي مثلي مصابة بسرطان الدم.
قمت بس ما أمشي، رجلين يعني ما أقدر أمشي. أي بقيت بس إبرة واحدة وحاطة المدة. هاي الشعلات النار نقدر نشوفها من مزرعتنا، يطلع منهم دخان. بلقى نكمل هذا المخطط قاعد نصفر نطلعت بعدين نقع. هاي شوية حلوة.
منطقتنا بوسط أكبر حقل نفطي في العراق، ومع ذلك معدومة من الخدمات، ونحن معزولين عن بقية العالم.
السيطرة.
حقل الرمال النفطي تدير شركة بيبي البريطانية.
مدعون وصول الباحثين إلى هاي المنطقة حتى ما يشخصون حالات التلوث الموجودة فيه. علي شلونك؟ شلون صحتك؟
هواي عندنا بالمنطقة مصابين، وهواي اكو بيهم توفى، وهسه اكو بيهم عايشين جاعانين من المرض. واحنا بالمنطقة تحديدا منطقة الرملة ما حد يحكي، بس يحكي يقول لك انا اخاف، والله اخاف يشيلون.
عباس اي عافية تقعدين. عباس قد عمرك عمو؟ ها؟ 16 قد ابو تقريبا؟ ها؟ 5 خلصنا. شكرا لكم.
من غير القانون أن يتم حرق الغاز في مسافة أقرب من 10 كيلومتر من المناطق السكنية. كل الأطفال اللي أخذ منهم دكتور شكر العينات هم يعيشون بمسافة أقرب من 10 كيلومتر عن الشعلات. هذه الشعلة تبعد عن بيت فاطمة كيلوين ونص في حقل النفط تديره شركة إيني الإيطالية.
حياك الله.
كيف الحال حجي؟
حياك.
شلونك؟ شلون صحتك؟ أحوالك؟
الحمد لله.
أنتم تشمون غازات هنا في هاي المنطقة؟
دايرة علينا كل هاي نفط، بس انت قاعد شوف بعينك، شوف هاي الجو، شوف.
اي ما ادري، انا سمعت انه صارت عندكم حالة لبنتك؟
فاطمة صار لها سنتين، العام شهر الثاني، بداية شهر الثاني سخنت ودنا الطبيب فحصل قدمها 3. الاخبار شلونك؟ هاي مو اكو نزل ثاني برجلين.
فاطمة ما زالت تنتظر متبرع لعملية زراعة النخاع العظم.
تحتاج يعني وجود مطابق، والمطابق لازم يكون 100% حتى ترسلها يعني. زين أحسن. شميل ليش ترسل؟ زين قاعد تستجيبين كل زين. بعدين ما وجه.
يعني وايد قبل أشوى، قبل بالشهر يجوها مرة، هسه قامت كل يومين، يوم الثالث يجوا لها، وقامت ما تاكل، خشمها ينزف، قام واحد يحترق، يشوف ابنه قدامه مريض مثل واحد مشتعل به نار وما يقدر يطفي.
الشعلات ليس مضرة على صحتنا فقط، أيضا تؤثر على الكوكب بأكمله. إنها تطلق غاز الميثان وثاني أكسيد الكربون، والتي تسبب الاحتباس الحراري. قناة بي بي سي كشفت حجم الغاز اللي يتم حرقه من خلال بيانات الأقمار الاصطناعية.
BP's annual report makes it look to investors and the public like its flaring emissions are going down overall. But because it doesn't count emissions from sites where it's not the official operator, those aren't included. This is the case with Rumaila.
BP's annual flaring in 2021 across the whole world stood at just 4 million tonnes of CO2e. And that's misleading, because if Rumaila was included in those figures, they will be doubled. BP is concealing the true scale of its flaring emissions from the public and from investors.
خلال تصوير البي بي سي وصلت أخبار حزينة عن فاطمة.
هذا توفت بي. هذا شخير شيء وتقول أنا ما أموت، ما أموت.
بالمستشفى تشوف جماعة الطفال يموتون ياما، وهي ما لها غلط يعني، كلش يعني لآخر يوم هي يعني قوية.
مثل كل مرة وياها.
بعد أشهر من المراجعات العلمية المستقلة، حصلت بي بي سي والدكتور شكري على نتائج التحاليل ونسب التلوث.
If I just look at the benzene data, we're seeing values from 3 up to 9.6 micrograms per meter cubed, and immediately that causes some worry to me. The WHO, for example, it has said that there is no safe level of benzene.
The children, they have strikingly high levels of metabolites of PAHs in their urine. From Rumaila, all of the children sampled there have high levels. 70% of the children that you sampled have high levels in their urine.
احنا كنا نقصد انه نكشف مركب البنزين اللي موجود بالهواء. صراحة كانت نسبة مرتفعة.
معلومة. وهاي مريضة مدة نوديها مرة بطنها مدري شنو، وعندها حصوة وعندها رمل. الحل احنا شو نسوي بهالحالة؟
يعني أنا مهمتي إنه أحذركم، أنبهكم، أوعيكم.
احنا نعرف يعني، احنا نعرف هاي، كل واحد يعرف هاي الشغلات، يعرف الدخان هاي النفط هاي مضر، بس الحل شنو؟ نريد الحل. الحل شو راح نسوي؟ حل الا الدولة تسد هذني، تفكنا من هنا تسويهن.
حقل الرميلة هو تحت إدارة بريتش بتروليوم، وهو المسؤول عن كافة القياسات البيئية والصحية بهذا الحقل. فإذا فعلا هنالك عوامل خطر من هذا الشيء، فبريتش بتروليوم شركة النفط البريطانية مسؤولة عن إدارة هذا الموضوع، وأنا راح أدقق بالموضوع.
أنا دائما كل ما أستيقظ أقعد أشوف الحديقة، أسقيها ماي، أداريها، أزرع بيها.
بعد يوم واحد من نشر قصتي على قناة BBC، جاء موظف من قبل شركة البيبي وتحدث معي حول وضعه الصحي، فأخبرته بما عانيت بسبب التلوث، وسألته هل من الممكن تعويضي من قبل الشركة، ولكن لم يتواصل معي مرة أخرى.
This was a very difficult documentary to watch. And as Owen said, our main protagonist, Ali, is also no more. So this is the core of the issue. Air pollution, environmental harm is a matter of life and death. It's a matter of justice. And I'm still sort of, every time I watch this documentary, it happens to me, so please forgive me. But it also comes back to the fact that we need to channel this grief and this anger into making a change that matters for the families of the children we saw and many, many children around this world who don't have a voice to express themselves about the injustices that they're facing. We were very intentional in designing, and I hope that this works, how we have designed the session. You've seen this powerful documentary. We will now invite our experts who are health experts, medical doctors and scientists, journalists, and environmental activists, and young public health professionals who will come and try to share their experiences and their understanding of how do we articulate this whole story of air pollution and injustice, and how do we make sense of it. So we will invite our panelists now. Let me start with calling Dr. Arvind Kumar to the stage, Dr. Ruby Pawankar, Owen, Heng, and Dr. Salman Khan. So please. We will invite each of our panelists to make a short intervention. Some of them will show you slides. Some of them will also show some of their stories. And then after their interventions, we will go into the format of asking questions, and how we are envisaging the question answers in the interaction section is that I'm going to just be moderating, and that's your time to express, ask questions, and ideate collectively. How do we take this conversation forward? So given that this documentary had a lot of health narratives, I would like to invite Dr. Arvind Kumar, who also spoke at the plenary, so needs no introduction, but he's a thoracic surgeon and a clean air champion. The reason why I call him a clean air champion is because as a doctor, he's chosen to take time off his clinic to talk to us about air pollution and health. So, sure. Yes, sir.
Thank you, Shweta. And thank you, Owen, for that. I won't say powerful. You have to invent a new word. really moving story. But Ali was not alone. Ella, whose name you heard in the previous session, who died of asthma exposure in London, and who was the first case in the world where a court ordered that air pollution exposure leading to asthma exacerbation should be written as cause of death in her death summary. It's the first case in the world. These people are not alone. There are millions and millions of such children and adults across the globe who suffer in the past, are suffering today, and will continue to suffer in times to come unless the world decides that this is a serious health matter, cannot be allowed to go like this. Even if it means an inconvenience at personal level, something needs to be done quickly. So over the next 10 minutes, which Shweta has allotted to me, I'll very quickly, it's a presentation which is actually went for about 20 minutes, but I'll quickly rush through the slides to give you an overview of how it's a health issue. As I said, people consider only lungs as the organ involved, but it's much more. Next slide. So I'll be saying next slide, and please quickly. This presentation comes from Lung Care Foundation, which is an NGO I founded after seeing those horrible lung images, and Doctors for Clean Air and Climate Action, which is just a network of doctors which works in this area. So if you're a doctor and you're passionate about this topic, you're welcome to be a part of this network. Next slide. So this question often asked is next, does it affect health? So I put 8 questions. I won't be taking, details of each, but just to touch what age do these effects start? What happens in childhood? What happens at birth? Which organs are affected? What diseases are caused? Does it only cause disease or kill us prematurely, as you have seen in this movie? What is the magnitude and the economic angle, which is often talked about? Quickly, next one. Next. Yeah. So as I said, the effect starts when the child is still in the uterus. If you just remember this, air pollution does not wait us to be born. It starts hitting us hard even before we are born. Next, when we are born, we don't get any important air. We use the same air. And there is a formula. In terms of damage to the body, 22 micrograms of PM 2.5 is equal to 1 cigarette. So in my city, 250 is the average PM 2.5. During winter months, it even goes up to 1,000 or even beyond that because the needles stop at 1,000. So it's equal to 10, 15, 20, 30, 40, 50. I don't know how many cigarettes a day. And this is breathed by the newborns also. So I dare say that in polluted cities, the newborns become smokers. Next. So this is how the air pollution starts. Next. And when the child continues to breathe this bad air during his childhood. Next. Just run through these slides. Yeah. Next. Just keep moving till I say stop. Yeah. So the child keeps inhaling these toxins, and every organ in the body is affected. So in polluted cities, pneumonia due to exposure is one of the commonest causes of mortality in the under 5 population. It affects growth. So now there is data, brain growth, it's, you lose about 10 IQ points because of exposure. Your lung development gets affected. Next. And the worst, next. Yeah, just keep moving. Next. This is something that happens very commonly in our country. I'm sure a lot of places where people use this cow dung or wood for household cooking, and that smoke comes inside the room. We've shown that 25,000 microgram per meter cube is the level of PM 2.5. You can imagine the exposure to that little kid who's sitting next to his mom watching her cooking. So this happens and this kills them. Next. Often asked question, which organs in the body are affected? Ladies and gentlemen, please memorize this picture. These are the only organs affected. The rest of the body is unaffected. So the truth is, from brain to toe, no organ. And now last 10 years, so much of data has come that there are medical associations who are suggesting that this should be, when we take medical history, we ask the patient's name, age, sex, family history, this history, menstrual history, smoking history. Now pollution history also should be included, and time will come where no disease will be not affected by pollution. Breast cancer, now latest report from Europe says even breast cancer is affected to air pollution. Next. So this is the lung that we are born with. Next, next, next. Yeah, you can see the change that happens to your lungs as you get exposed. And ladies and gentlemen, this change is happening silently without us being aware inside the bodies of all of us, which includes me too, because I stay and breathe in Delhi, which is one of the most polluted cities. I'm sure one of these two will be the color of my lungs as well. Next one. So so there is no organ which is spared, but of course the worst affected are lungs. Next. Next. So in the lungs, asthma, allergy, madam is here, she'll be telling you more, COPD, ILD, increased incidence of tuberculosis, and most dreaded lung cancer. In the pollution impacted cities, there is almost an epidemic. I am a lung cancer surgeon. There is a several-fold increase in lung cancer cases, more and more in so-called non-smokers. There is no true non-smoker, so-called non-smokers, younger people. So the youngest patient I have seen is 24-year-old girl who was living very close to a very densely polluted area. More and more non-smoking women developing. So the difference between smoker and non-smoker is gone. And a lot of people smoke. If that be so, why not we all start smoking also? I mean, they say it jokingly. It reduces the lung capacity. So it's known that people who are children from these cities are not having their lungs developed as much as they would. Next, just quickly run through heart. So premature hypertension in school kids is reported to be about 20% in our city. And now it's known it's because of exposure to air pollution. In adults, heart attacks are common. Whenever there are peaks of air pollution, a week later, all hospitals report an increase in the heart attacks. So heart attacks, air pollution exposure, there is a direct correlation. Next one. Likewise, when it comes to brain, school kids these days are very, very hyperactive. So people say, oh, it's all because of they are naughty children. No, they're not naughty. They're smoking all the time. So there is brain swelling. It's called neuroinflammation. That is what is making them hyperactive. And in adults, again, like heart attack, brain attack is occurring. Again, the direct correlation with air pollution exposure. Next one. So cognitive development is affected. It affects the elderly also. Next one. Diabetes is increasing like this in my country. One study showed about 11% of the population affected, another 8% pre-affected. And now there is data that these toxins go to the pancreas, which is the organ from where insulin is released, and this is the cause. Likewise, next slide. Obesity is increasing in our country. Again, we did a study where we found almost 1/3 of the school kids in Delhi to be either overweight or obese. And that also now is because of the air pollution exposure. So you are obese not just because of what you eat, but also because of what you breathe. Next one. Likewise, eyes are affected. Next one, skin is affected. And all these are known to all of us. So overall, there's no organ which is left untouched. No, next one. Next. So the worst affected are unborn babies. Children, unborn babies, because they are developing. When the organ systems are developing, you put a chemical there, it affects the development. Children have low height, so they have more exposure per body surface area. They breathe higher. Adults 16 times a minute. In children, it's up to 30. So they breathe more, so they take in more toxin, and their tissues are growing, so they are affected. Similarly, elderly, because their immunity is low. So this is what we call vulnerable population, which suffers the worst effect. Next one. Next one. So Dr. Maria mentioned in the morning about 7 million premature. Now, this is an estimate. I'm sure the actual figure is much higher because a lot of people are dying where this is, unfortunately, unlike COVID, which killed, and you knew, oh, this person has died because of COVID. Air pollution does not kill directly. It causes lung cancer. So if I see a patient who has lung cancer, which is because of exposure to air pollution, and he dies of lung cancer, the cause of death is written as lung cancer. Air pollution never finds a mention in the cause of death, which is the reason why I think it doesn't get the attention it deserves. Next one. It kills every year more than the number of people who died in the entire COVID. Next. 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 This is an important pyramid. We take death as a measure of the volume or extent of damage. But ladies and gentlemen, if you look at the bottom, this is the normal population which starts getting exposed. God has given us a lot of extra capacity in every organ. So when you are exposed, suppose lungs are exposed, they are disease. So almost about 50% of the capacity is affected and you have no symptom. So that is what is called normal but exposed population. As you start getting affected, maybe some tests will detect something at that time. As you get worse, you start developing some symptoms, and then more symptoms, and then more symptoms, visit to doctors, visit to ER, and finally you die. So death is just the apex of the pyramid. There's a lot of disease, disability, which is caused before that, and economic cost of that is colossal. Next one. Next. Next. So when you calculate economic cost, the direct cost of treatment, which is in millions. In fact, one person jokingly suggested that in a polluted cities, you should have helicopters spraying bronchodilators instead of everybody carrying a bronchodilator puff in his or her purse. It's so common. I never used to write bronchodilator, but these days, all patients, when I discharge after chest surgery, I have to write bronchodilator because they keep having cough, continuous cough. It's so common to find people coughing all the time in these places. So that's a direct cost. When a person is sick in the family, the whole family gets affected. They have to take leave, indirect cost, and of course, premature death. So if you add all this, it's a huge cost. There was one study from IMF or World Bank which suggested about 8% of the GDP is lost because of the effects of air pollution. So those who say that change will cost, I tell them that not changing will be worse in terms of costs. Next. Often asked questions. Morning also I was asked, do air purifiers help? Next one. Do the masks help? These are, next one. These are personal solutions to a public problem. You put on mask, simple cloth mask, and the usual surgical mask doesn't help. N95, if worn all around the nose and mouth, helps only as long as you're wearing. Can you imagine somebody passing whole life with mask on? We don't even see each other's face. I mean, what kind of life is it? Similarly, air purifiers like air conditioner, it only helps as long as you are inside the room. But the moment you step, and you have to keep the windows, doors, everything closed. The moment you step out, you are exposed. So these are very personal solutions to what is a public problem. And I don't think anyone should be suggested. A lot of people have tried to divert attention by saying, oh, no problem. Let's have air purifiers across the country. All these were attempted, but these are just diversionary tactics. Let me summarize that mask and air pollution is not a solution to the air pollution problem. Next one. So it's an international. Often people say, oh, it's only this country, that country. As Dr. Marianera said, that majority of the people, you leave a few developed nations, even then there are pockets where people are exposed. There is most of the population is exposed. Some may be exposed less, some may be exposed more, but it's an international health emergency. Next one. It's an invisible killer, and that's the saddest part, that it doesn't get the attention. Next one. So, as was mentioned by Mr. Harjit in the morning, it's the fossil fuels which are the culprit. Solid, liquid, as well as gas. A lot of people are promoting gas in our country. CNG, they have green this thing as if CNG is a very, very safe. No, They're relative less or more, but all forms of fossil fuels are, and they're a threat not just to us, the human beings, they're a worse threat to the planet. So planet and people both are facing existential crisis because of this. Next one. So what is the solution? Unrestricted use is the root cause. Next one. The solution is transition away from fossil fuels in all its forms across all sectors into cleaner sources of energy. And what kind of transition? Next one, the transition must start immediately. There's no point making 30, 40 years plan that, okay, we'll do it by 2070. Human race may not exist by that time if the present situation continues. It has to be immediate, it has to be major, it has to be effective, it has to be equitable and just. And last slide, I feel that unless we create an agitation across the globe, and that's why I say doctors have a very, very special role to play if we keep talking to people. In fact, I'm suggesting that all our prescriptions on the back side should have some write-up or something about air pollution, so that when they get our prescription, they also get information that it is because of air pollution. A dialogue involving every human being on this planet. And this picture of lungs reaching every beyond is important, because unless people are agitated, they will not demand from the politicians. And unless it's demanded by the people, the solutions will not come. Thank you very much.
Thank you, Dr. Kumar. So Dr. Kumar gave a very good health, medical perspective and overview of impacts of air pollution. I would like to invite Dr. Ruvi Pawankar now, who, and my request to her is to walk us through the interconnections between planetary health, One Health, air pollution, and the role of science.
Thank you very much, Shweta. It's my pleasure to actually have the opportunity to speak here. I think with a powerful talk from powerful movie, in fact, initially, which was very moving, and I almost had tears in my eyes seeing that, and the powerful talk by Professor Arvind Kumar, things are much easier. So I'm going to keep it very short, and we'll be happy to discuss further. I think he has really covered all the important aspects of air pollution. So I'm going to just touch the key points to keep it short. So as we all know that human activity since the start of the industrial age has increased fossil fuel utilization, emission of heat trapping, greenhouse gases, rise in global surface temperatures, and frequency and duration of severe weathers, which we see all around, even in Asia, including thunderstorm, which is leading to severe attacks of asthma and death. The human exposome, which is a cumulative measure of all environmental exposures, whether it is biological, chemical, and physical, encountered by any single individual in a whole lifetime, is also adversely affected by climate change. These modifications in the exposome have led to a higher prevalence of non-communicable immunological diseases such as asthma, allergy, obesity, diabetes, cancer, and so on. Now, when you look at this and you see the environmental and the lifestyle risk factors of the exposome, taking just as an example, allergy, that's my specialty, we have genetic factors. We know children inherit things from their parents. So genetic factors contribute to asthma, rhinitis, eczema, food allergy, atopic dermatitis. Then you have pollutants, which are indoor and outdoor. You heard a very good talk on that, talking about the outdoor air pollution and indoor also, and the different forms. Then you have biodiversity, which is very crucial, because there is a huge loss of biodiversity, which is really directly impacting climate change. Urbanization, industrialization, change in our dietary habits leading to Western diet, lack of vitamin D is seen in many countries in South Asia. And then we have the microbes, which is the microbiota in the human body. The gut microbiome actually matures in the first 3 years of life. And when that gut microbiome is programmed, or there is a dysbiosis, a difference in its composition, difference in its diversity, that programs the child already to different diseases. As Professor Kumar mentioned that in the womb things, similarly in the womb, the microbiota are already programmed. And we have to therefore take care of the environment of the mother, the food, the nutrition of the mother, all these at that stage to prevent this from getting worse. Next slide, please. Next slide. I mean, just let this go to the, yeah. So as we heard so much about air pollution, where are the different types of, we have the gaseous and we have the particulate matter. We have the primary, secondary, and you can see here that can come from ground transportation, from stuffs. Kerosene is very seen in villages, leading to biomass, industrial pollution, atmospheric oxidation, and we have PM 2.5, PM 0.1, and PM 10. And if you look at this, the air quality and climate change are closely intertwined. They are linked. They are causing. So it's air pollution, other forms of pollution, which include food, soil, water, all these, and the loss of biodiversity, all these together contribute to climate change. And that is what is causing the planetary crisis. And that is what we are facing today. And that's what we're all gathered together in this wonderful FAM meeting to address planetary health, because that encompasses every form. And that is what we need to change for the future generation. Even if it doesn't help us now, it will help at least the future of the planet and of the people that are going to come into this planet, if we really want the planet to exist. Now we look at the different respiratory health effects as already spoken by Dr. Kumar. Oh, can I have that slide back? So you can see cardiorespiratory disease. What are these different pollutants doing? You can see hospital admissions. You can see hospital admission by asthma, individual attacks of asthma, asthma exacerbation, allergic rhinitis, respiratory allergy, hay fever, bronchodilator usage, school absenteeism. Wesley, all these different things you can see are all affected by the impact of outer air pollution and also indoor air pollution. Next slide. And this is what we published in the World Allergy Organization's White Book, which we pushed and we put it into the UN Biodiversity Conference and we send it to the United Nations and the World Health Organization to realize how much what air pollution. Today, of course, we have it as important guidelines on air pollution. Look at smoking, and we heard so much about smoking and the prevalence of allergic diseases. This is done in Japan, and you can see the direct correlation between the ETS exposure and the development of asthma and allergies in small children from pregnant mothers that were being exposed to. Again, you heard it. I'm just repeating the same thing through data and showing that data-driven science tells us it's time to wake up. It's time to act. We cannot wait. It's important. And I would like to quote Professor Jamila's inaugural speech, push, push, push. That's what we need to do. I'm not a gynecologist, but I will say the same thing. We need to do that. We, in each and every one. It's not the governments, it's not just the NGOs, it's not the global bodies. We as civil society need to arm ourselves and realize that we have a social responsibility. We have a responsibility to the planet that we live in. Next one. Now, we talked about phthalates, benzene. Look at this. We saw the film on that. Look at this. Where is the phthalates? Not only coming from those flares, it's there in our house dust. It's there in our house dust. And look at this. The levels of all these different types of benzene products in the floor dust was associated with the prevalence of different allergic diseases, and the children were more vulnerable to it than adults. And this is just allergy. I'm just giving you an example. We have other diseases also lined up that is being caused by this kind of benzene and phthalates. Next. And we look at the Lancet Commission again and look at the different causes of death. We talk about road injuries can be a huge. In India, of course, we see the trauma centers are full with patients, road injuries causing deaths, AIDS, infectious diseases, AIDS, tuberculosis, malaria, COVID-19, you just heard the same thing that happened. All these causing, but what is the biggest killer? It's pollution and smoking. And smoking is pollution. So it's indoor, outdoor pollution. So it's the biggest killer. So that's what we said during the COVID. Air pollution kills more people than a pandemic. And climate crisis is also causing the pandemic, because that's what happens. When we are not in good harmony with nature, with the animal and the human system and the ecosystem. When we are in that planetary crisis, that's when zoonotic diseases increase. And what is the result on GDP? People talk about GDP. There's more loss of GDP from that, from COVID, than you can imagine from any other inflation. Next slide. And this is the white paper which we produced when I was the president of Apache. And this is talking about biodiversity, loss of biodiversity, air pollution, and climate change in Asia Pacific and the impact on allergic diseases. I'm not going to discuss this because it would be, again, take a lot of time on that, but just trying to say that we're very focused on addressing this issue in our region. Next. And if you see, look at this, Asia Pacific. We are the largest population in the world. We comprise more than half the population. That's why I would congratulate Professor Jamila again today for bringing FAM to Asia, bringing the world's attention to here. This is where we need to start the action. It's so important. And we should help the other regions like Africans, all because they have less emissions, but they are the most vulnerable people, vulnerable societies. They need help. So this is very, very important to look at the amount of what's happening in our region. Next slide. So in summary, just to say that the levels of ambient air pollutants in many Asian countries are very high, in particular traffic-related pollutants. The closer you live to a high highway, the more prone the children are to developing different allergic and immunological diseases and autoimmune diseases. And I have to say, I'm not sure I put that slide in. If not, I will just say it verbally. And you can see that the loss of protective factors associated with the rural environment also further contributes to these adverse effects. Next one. And so just as a diagrammatically to show how allergens and these air pollution and outdoor pollution produce oxidative stress, they actually cause a disruption of the epithelial barrier. Now, what is epithelium? Epithelium is the outermost layer of every organ. And if that is very tightly, that prevents external things from entering the organ and the human body. But when that is disrupted because of pollution, it causes a translocation of the microbiome into the tissue, and it damages and becomes a leaky epithelium so that everything. And you know what all causes this? It's not just the air pollution. Detergents, cleansing material, so many of these things that we use in daily life are actually damaging our epithelium and making us more prone to it. So what can we do? How can we address this? It's very, very important. Next one. And this is the loss of biodiversity. Look at the diseases. It's not asthma and allergy only. IBD, cancer, diabetes, celiac disease, Hodgkin's, non-Hodgkin's disease, Wegener's granulomatosis, the number of diseases that are actually affected by the loss of biodiversity. And this is science-driven data. This is not my opinion. It's not an expert opinion. This is science-driven data. So we need science-based solutions, and we need to act. Next slide. Nanoparticles and microplastics, a huge problem. We have to address this. The fish, the marine animals are all actually ingesting this, and we are ingesting that. Imagine what we are facing, what our children will face. This needs to be addressed, which is a huge problem in itself. And I will not go further. And this is what happens. And this, of course, I'm sure, as you know, in the generation before, the microbiome, the transmission, there was a vertical transmission from the mother, clean environment, less polluted, diet much better, lifestyle much better, and there was a very replete ancestral microbiota. And so the innate immunity to adaptive immunity, you get a very mature immune system, robust immune system which protects you from diseases, that prevents you from all these external issues. But what happened now? What's the situation now and what's the future? You can see decreased vertical transmission of the microbiota, decreased horizontal transmission. You can see from the mother to the child, from the pregnant mother to the child. And when the child is born, the child is already born with a depleted microbiome already. And therefore, there's an altered maturation of the adaptive immunity and increased incidence of autoimmune disease and inflammatory diseases. So just see what happens. An innocent child, as we saw children being received, at birth, this is what happens. So how can we prevent this from happening? It's so important. So maternal diet, maternal nutrition, environment in which the mother is living is so important. Next one. And what's the impact on climate change on health? Well, this has also been addressed very nicely by Professor Kumar, but see the respiratory system, you can see inflammation of the lungs, exacerbation of allergic disease and other respiratory conditions, increased influence on certain vector-borne diseases, as I said, COVID-19 and other zoonotic disease like dengue and Lyme's disease and so on, increased incidence of waterborne diseases because of water pollution also, mental health. We never think about mental health. When we talk about everything, the physical health is important. Imagine the physical health is controlled so much by mental health. And this is neuroinflammation that Professor Kumar also talked about. Neuroinflammation. The mental health needs to be taken care of, and the mental health is affected by the forest fires, by the thunderstorm, by the many things that we are facing. Imagine families having to face all this, the children being like this, the trauma that is caused mentally because of the climate factors. Cardiovascular system also, and immunity and allergy. Next. So we have planetary health as the health of the human civilization and the state of the natural systems on which it depends. I know this looks like a very complicated slide, but if you see that the impacts of planetary health, it impacts on the child, emotional and cognitive health, physical and emotional health, attitudes and health behaviors, genome and epigenome, the human microbiome. And these are the different factors around it that actually cause it. And it's including food and agricultural systems, media marketing, governance, urban systems, attitudes and values, social and environmental justice, education, all these, and it's bi-directional. So it's so important that we address this and we need to act. Next one. Next slide, please. And the One Health concept also, which has been there now for many years, is again looking at the human health, the animal health, and the environment, and looking at this as interconnectedness of the human, animal, and environmental health, and recognize the impacts of climate change on these systems. So this is very important, and the importance of digital health. You also heard many nice talk on AI. So AI will play an important role, and also digital health, monitoring the real world data, diagnosis and monitoring of air pollution. All these things play an important role in our action items that we will do next. So just to give you just a summarization of what is One Health, Eco Health, and Planetary Health. One Health focuses on it's an umbrella, including environmental health, ecology, veterinary medicine, public health, human. So the human, animal, and the environment. And the Eco Health is committed to fostering the health of the human animal ecosystem, conducting research which recognizes the inextractable linkages. So it's focused on the relation between health and the ecosystem. But planetary health is an overall umbrella of all this. It is more holistic. It overarches above everything else. And it's the achievement of the highest attainable standard of health, well-being, and equity worldwide. Equity is so important. Justice, equity is so important. The health of the living and future human generations applied to individuals, not just individuals, but communities, very important. And also focusing on socioeconomic, regional, and gender factors. Because very often, as also shown, it's the mother, it's the woman, it's the elderly, and the child who are more affected. So it requires sustainability based on natural resources and biodiversity. So thank you very much for your kind attention.
Thank you, Dr. Ruby. We're talking about air pollution. We have heard from, we saw the film about the emissions in the Middle East. Dr. Kumar definitely referenced a lot of his experience from New Delhi in India. I have my colleague Heng with me from Greenpeace Malaysia, and I would like to invite him now to talk about the transboundary air pollution experienced in this part of the world in the Southeast Asia and some of the strategies in combating it. Heng, can I have presentation number 4, please?
Okay, yeah, can play the video.
You go.
Next slide. Okay, play. Okay, next. Okay, play. Okay, next. Okay, yeah, just now the short video is show about the how seriously the haze emergencies and affecting vulnerable groups from parents, from the old peoples, and also from the children's. Okay, you can call me Heng. I'm a campaigner from Greenpeace, Southeast Asia, based in Kuala Lumpur. So I'm going to share with you, just now we have listened lots of wonderful presentations from other panelists. So I'm going to share with you some serious air pollution issue in Southeast Asia. So next slide. Okay, if you go out just now, I think this morning I just received news alerts saying that Klang Valley in Kuala Lumpur also have a very serious air pollution issue. You can just go out and check it. And I think that is one of the key problem happening in Southeast Asia. Okay, we known as transboundary haze. Okay, haze is caused by a lot in Southeast Asia. Haze is caused by the peatland destructions and forest fire. It's also not just from Indonesia, but also there are some wildfire came from Thailand and northern regions, part of Malaysia. So in early 2023, transboundary haze are also linked to the monocrops from the maize plantation in Thailand and Mekong area, whereas there are also local haze in Malaysia. For example, there are also a haze caused by the local fire in Johan Setia Selangor, in Rombin, in Pahang, and also in Kelantan. Next. So what is meant by peatland? Peatland in Bahasa we call Dana Gambuts. So this is the original form of peat forest. When the peatland has been drained from plantations, it will easy to get fire. So you can see the third one. The bottom one is the situations of the land in Southeast Asia, especially Indonesia and Malaysia. So next. So this is the example of the peat soil, Dana Gambuts. Next. Okay, play the video.
Jadi tidak harus dibakar oleh manusia. Tidak harus dibakar dengan sengaja. Orang lewat buang rokok habis kayak gini kalau dia kering. Dan itu main bawah semua. Terbakarnya di bawah, jadi yang keluar hanya asap saja. Habis semua.
Okay, next. Okay, so that is, can you imagine a small piece of the peat soil? It can generate so much of fire. So the situations now is Indonesia and Malaysia. There are lots of the peat forest that has been drained for plantations. So who should be responsible? So in our investigations, we found that plantation sector and government need to be responsible to deal with these situations. Next. Okay, so what are the solutions? So for Greenpeace, after we bear witness, we go out there and collect the information. We found out that there's 3 solutions. The first one is protect the rainforest, protect peatland. The second one is the company's role. The company have a policy known as NDPE, no peat, no deforestation, no exploitation. They have this policy, they have to enforce it. We need all the company to walk the talk and ensure it to enforce it through their supply chain. And then the third one is this ASEAN's government, which is the government in Southeast Asia. They have to end deforestation and also support the ASEAN transboundary haze pollution agreements. Next. So this is not river. This is the drainage caused by the previous plantation company. What the local community doing right now are they are doing the peatland restorations. Once they keep the water inside, and then they will re-wet the peatlands, it will keep the original forms to the peatlands. So now next slide. Okay, these are the example. If you look at that, after they restore the peatland, it won't get fire easily, and then it will turn into green color. Okay, next. So this is one of the efforts of peatland restorations. Play with video. Okay, next. That's not enough because the destructions is faster than restorations. We have a local committee who are doing putting a lot of effort to restore the peatland. However, a lot of the big companies are still destroying rainforests and causing the haze. So we publish a few reports, and then we name and expose the company who are still causing the transboundary haze problem. Next. So is there any good progress? Just now we mentioned a lot about the problems of air pollution. Some people that say like, okay, it's very depressing. So is there any hopes? Or can we send any good news then from our side? Yes, we have. Next. And just for information, there are some commitment made by some company. For example, HSBC, one of the biggest banker, last time they used to fund forest destructions. But after the customer credit card holder pressure the banker, and in 2017 February, HSBC make a commitment that they do not fund forest destructions, which means they cannot provide loans or money to the company that involved in forest destruction. This is a good commitment, but that is not enough. We need more company to join the movement to stop deforestation. Next. And after that, 2 months later, because of the commitment made by HSBC, Malaysian palm oil giants, IOI also make a commitment to eliminate deforestation and human rights abuses from their supply chain. Because IOI also get the funding from HSBC. That is some positive story that we want to share. If you look at these two case studies, we can say that IOI and HSBC, they were naughty boy. They were used to involve in forest destruction. But because of the movement, the demand petitions by the global community, the demand for change, all these companies started to listen to people, and then they will make commitment, and we need more company to join the movement together. Next. So when transboundary haze and air pollution is so serious in Southeast Asia, especially in Malaysia, a lot of Malaysians always point finger to Indonesia. They say it's caused by Indonesia, which is not correct. I want to say that a lot of Malaysian company and also Singaporean company are involved in causing this forest fire. So we cannot just blame Indonesia for causing fire because Malaysian company are involved. Next. So what we need to do is, okay, the 2022, there are some cases also in Indonesia. There are two big Malaysian company that also lost their court case in Indonesia. So this is one of the results that shows that Malaysian company are also involved in forest fire. Next. So yeah, is there any, just now I think you can hear like the haze, the transboundary haze and also air pollution. Yeah, it's been around, I think, since 1997. And then when I was a school kid, I was told to wear face mask. That is, I wear face mask, N95 face mask, not because during pandemic, and it's during the haze season in 1997. Next. Yeah, and then the study also found that like air pollution is also very contagious and also linked to many health problems. Next. So what we can do, yeah, transboundary haze in Southeast Asia, this is not fine. And we have a heat wave recently, and yeah, it's very hot now. And this heat wave is making the air pollution, the forest fire even worse. Next. So what we did was we submit our complaints, air pollution complaint to Malaysian Human Rights Commissions. We want to highlight that we want to demand a clean air as a basic human rights. Next one. Okay, what is our recommendations to human rights commissions? Our recommendation is amend the federal constitutions to recognize right to safe, clean, and healthy environments, and then enact a Clean Air Act or Transboundary Haze Pollutions Act. And yeah, accelerate the development of the National Action Plan of Business and Human Rights, and also push for the Sustainable Development Goal. Next one. So our demand to the government in Southeast Asia, every country, they have to enact a domestic Transboundary Haze Act, especially also make all the company to publicly disclose and publish the concessions map so that we can put the bad apple under the spotlight, which also good for the industry who are making commitments. Next. So conclusions is, yeah, clean air is basic human rights. So stopping forest fire is the international, at the heart of the International Climate Change Agreement. If we do not stop forest fire, we cannot stop climate change. Next. So this is one of the video we have done to 2 minutes video to highlight that the seriousness to hold Malaysian company to account. Play with the video. Okay, next. Okay, so yeah, that is the videos. Our message is clean air is a basic human right. If we really want to tackle the pollution and solve the pollutions, we need to make sure we need more responsible company to take a stand, and we need to hold the big polluter to account. So we have a current campaign known as Tak Nak Jeroboh or Clean Air Campaign. So for more detail, you can go to our website, hashtag Tak Nak Jeroboh. It means that clean air, no to haze and clean air for all. And you can sign the petitions there. So I think, yeah, next slide. So I think that's all from me. Thank you.
Thank you so much, Heng. Thank you, everyone, for your patience. We have our last intervention, and then we will get into the conversation and question answer. We have Dr. Salman Khan, who is from the International... Okay, my mind is like really... International Federation for Medical Students Association. I don't know, I say this like 5 times a day, but still I sort of missed it. How are young health professionals working on solutions and leading with hope? Dr. Salman?
Thanks a lot, Shweta. Just a quick correction. It's soon to be Dr. Salman. I'm not graduated yet. Yes, couple of weeks. But before moving ahead, I just wanted to quickly clarify if you may recollect this name. I also share the name with a famous Bollywood actor, but I just wanted to clarify that I do not know how to drive and I love animals. If you know, you know. Okay, let me shake things up a little bit and tell you about my story. So, aside from being a medical student, I am one of my 4 family members, and all of us are, let's say, vulnerable people because of the impacts of air pollution and climate change. I'm asthmatic too. And when I entered med school, I was quite curious to know if, um, if we as doctors are addressing the health impacts of climate change, air pollution, and biodiversity loss. Um, Surprisingly, there was nothing. And I was anxious as a future provider, and I did not know if we'll see the light at the end of the tunnel. This is how I would look like, and this is how artificial intelligence would describe me as an anxious first year medical student wearing a sleek modern stethoscope with several books open in his hand and trying to also breathe through an inhaler because of asthma. Looks out of a clinic window when patients are in distress, and it's surrounded by a hazy air and red sky from pollution. Also inserting a fun fact, I belong to one of the cities that is contesting in the Olympic Games of being one of the cities having a worst air quality index. So that's the Olympics we are playing. And of course, this reflects a very harsh reality. I also happen to join, let's say, an activist group, or rather an organization, which I'll be talking about in a little bit. And we sort of did some digging, did some research, and tried to figure out if climate change was incorporated into formal education for future healthcare providers, and more specifically, medical students. Surprise, surprise, it's not. 15, can we go back to the back slide, please? Yeah. Out of the almost 3,000 medical schools that we sort of surveyed, only 15% of them had a mention of climate change. Mark my words, mention. Not having climate change dealt with in depth. And only 12% of medical students had at least one student-led activity in climate change in their own university. So as you see, climate change and pollution is not just a health issue, it's a system issue, and it's percolating each and every system of our life. And we as IFMSA believe, and now you can go to the next slide, one's got to change the system or one changes nothing. And with this quote, and also a very famous quote that talks about never doubt that a small group of thoughtful, committed citizens can change the world. It's indeed the only thing that has. Let me introduce you to our very small group of 1.5 million medical students worldwide, representing medical students in more than 120 countries, and more than 130 national member organizations. We were founded in 1951 at the aftermath of the Second World War. And a little bit more about our journey so far in the climate activism space. We always think global but act local. And we've been dealing with this problem through education, advocacy, capacity building, and also campaigns. Internally, we are divided work-wise into 6 different standing committees, including public health, sexual and reproductive health and rights, medical education issues, human rights and peace, and research and professional exchanges. Apart from that, we're also accredited as a non-state actor in official relations with the World Health Organization, with UNFCCC, as well as having a special consultative status within the ECOSOC. Okay, so what have we done so far since 2017 to 2018? Our medical students, our very same group of thoughtful, committed medical students, had more than 100 initiatives or activities, ranging from local to national in this context, and they reached to more than 210,000 people um, across different population groups. And I'm just gonna quickly show you the next slides that are pictures of some initiatives that we've had since the past few years. Our initiatives have ranged from having a task force that helped in curriculum reforms and also reducing greenhouse gas emissions in hospitals in Quebec, Canada. The second on the top second picture is from an activity called Green SRHR in Ethiopia that talked about the intersections of climate change with sexual and reproductive health and rights. Third picture on the top is the Climate Alarm newsletter, which we recently have been working on, that talks about stories, lived experiences about people, and how medical students are, let's say, helping the community reach the light at the end of the tunnel. The last two activities, please at the back. Yeah, one of them is from Poland and one of them is from Sudan. The one on the left was talking about desertification, and the one on the right was talking about water, sanitation, and hygiene. Let's move to the next slide. And our initiatives also have varied towards online social media campaigns, on-ground protests, particularly at the COPs and the World Health Assemblies, and also participating in high-level meetings. So apart from being active, in on-ground initiatives and reaching out to different target groups, we also sort of try to capacitate ourselves in policy making and sort of understand what are the intricacies of planetary health within the global space and within the decision making fora. So we sort of stepped out of our comfort zone, which are clinics, and we moved forward. And let's move to the next slide too. We've worked on policy documents. Just to let you know, these policy documents are developed by medical students with their own knowledge and with their own capacity, and also recently supported by our partner organizations too. And our work is based on meaningful youth engagement, ensuring that the young generation are the key stakeholders in the present and the future of climate change decision-making processes, equity, diversity, and inclusion, as well as changes in the medical education systems. So what's the next chapter for us? First, we want to continue going through the journey of building a planet-conscious health workforce through recruiting more members in our organization, through continuously building our capacity and developing our skills, and amplifying the voice of the climate and health community. Of course, with this wouldn't be possible without the extensive support offered by our own partners and organizations, some of them who are sitting here in this very hall. And last but not least, I just wanted to let you know that medical students, us as future healthcare providers, do realize the need for climate action. We have the statistics there. We know the issues, but this is the moment where we shouldn't lose hope. We should support each other. We should be resilient together and overcome these challenges. Of course, it's going to be a very long journey, but again, it's about time that we take matters into our own hands and do our own bit to save the planet. And I guess that's all from my end. Thank you.
Stage. Okay, so we started a bit late. We would request 15 more minutes of your time, and I would like to invite all the panelists to the stage for just starting a conversation. And I'm going to use my privilege as the moderator to ask the first question. But Dr. Kumar, please, Dr. Ruby. Heng. We started with the film, with the BBC documentary. We have the director of that documentary among us, Owen. And my question is to him, given that he started telling us a story. We went through the whole section of science, medical evidence, young people, local issues. How do you see this narrative forming? What are the, as a storyteller, what do you see the narrative as, and how it needs to be communicated, given it's so complicated, it's so diverse, and yet it's so important? What are your reflections from today's session?
I mean, let's see if I can get this to work. Oh, yeah. Thank you. Oh, just to say as well, I was the producer of the film, not the director, because the director couldn't be here, unfortunately, Jess Kelly. But I did work on it for something like 2 years, which I think shows you how complicated this kind of story is, with, you know, in terms of like all the different layers of information that we had to kind of get our heads around as journalists, as non-experts. I mean, when I started working on this film, I'd definitely never heard of a volatile organic compound, and I had absolutely no idea what that meant. There were a lot of other acronyms as well to try and get my head around. And to be honest, it was, you know, it was scientists like, you know, those and doctors like those I'm sitting with here who made the difference in explaining things kind of clearly and patiently with me and my team. And obviously, as you saw in the documentary, we had Professor Shukri Professor Shukri Al-Hassan from Basra University, who kind of was at the forefront of all of the pollution monitoring that we did in Iraq. But there was a whole team of scientists that we engaged with who kind of talked us through and gave us the tools that we needed to tell the story. So, I mean, I think that's it. We were in a really privileged position as journalists to have that amount of time to work on it, and it's because we were making a documentary rather than, you know, rolling news. And I think the challenge is probably to be able to distill some of these facts and get them into the hands of journalists who are looking at health issues and climate, and, you know, it becomes more of a reflex to kind of to think about air pollution as a health issue and climate as a health issue. And that is more challenging when you're working on breaking news, for sure. But I think that's partly about you know, making the lines of communication clear with these scientists and experts who, you know, did such a great job in educating me from knowing absolutely nothing to knowing a little bit. Still not that much, but, you know, getting there.
Thanks, Owen. Yes, I was going to open the floor for questions, so.
Hi, everyone. Thank you so much for this very moving and impactful story that each of you have told today. My name is Tulsi from Planetary Health Alliance. And I guess I think I'm the voice of many of that. We're all incredibly frustrated by what we have learned today, but you're preaching to the choir. These are your people. We're all in support. How do we get in front of those who are not in support, in front of the energy companies, the transportation companies? Why are they not in the room, and what can we do to get them in the room?
You can start, but
yeah, I wanted to come back on that because after the documentary came out, we really felt that we wanted to continue the kind of message and the story, and a big part of that was Ali and his father, and trying to get justice for them. initially, obviously, we were raising money, or a campaign was raising money for Ali's healthcare. But after that, it kind of morphed into, after he sadly died, it turned into something else. And his father actually spoke at the BP AGM and kind of put the question of, what are you doing about Ali to the CEO? So I think, sometimes it is about confrontation, and that is a really important thing, and that kind of widens the conversation out. We also had shareholders. We had meetings kind of behind the scenes with shareholder groups who were interested in sort of pushing BP in a better direction, and they made their voices known at the AGM, BP AGM as well. And the fight continues, and there are other plans hopefully in the works to continue to hold the companies to account. Yeah, so I guess we do need to be confrontational as well as communicating in this way with as you say, allies.
Any more thoughts from Dr. Kumar? See if that mic works. You just might have to switch it on.
Yeah. So excellent question. Actually, so we all know that it's a problem, but the fact is that this knowing that it's a problem is confined to people who are sitting in this room. Because you are interested in it, you know a little bit about it, you got interested in it. That's why leaving your work, you've come all the way, sat here through the day, and you are aware of it. Go outside, talk to people in the streets. Even doctors. I'm a doctor. I travel across the country mobilizing doctors to talk about it. Can you believe when I reached out to about 20 medical associations of physician, surgeon, pediatrician, neurologist, cardiologist, cancer expert, anesthetist across the country. And I won't name, but there was one association whose president, when I requested that I want to have a meeting of all the presidents and secretaries of all these associations at Delhi, where I can share my slides and request them to make it an agenda in their national conferences, so it will spread. His question was, but this only affects lungs. Why involve me? And he was the president of the National Association of that specialty. And then I told him, no, sir, it does. And I sent him a few, oh, that's an eye-opener for me. I didn't know. So I thought to myself, if this is the level of the person who's heading a specialist association, what about the common man on the street? Madam, the fact is that people are not aware. And that is why, even at the cost of repetition, I would repeat what I said in the afternoon. It has to be a AAA approach. Awareness, make people aware. They're not aware. They think that, yes. Another thing is, a lot of people feel it's a problem of a particular period. In Delhi, the worst haze, we talked about haze, that haze comes in the month of October, November, December. I call it annual pollution festival, because rest of the 9 months, the media forgets about me. They don't remember my number. Come 1st of October, suddenly my phone starts reading and I have their numbers saved with media in the initial. So media, whole day. Oh, Dr. Kumar, it's very bad. We want you, please tell us how we can save ourselves. This starts, and then January, they again forget. People have to be told that it's a persistent problem. So awareness, once they are aware of the grotesque nature, awakening will come and actions will come. And I again repeat that action, we always say government is not doing it. Please look towards, when you point one finger at others, there are 3 fingers pointing at you. Pollution is not caused by governments. Pollution is caused by the activities of all of us. So if we start taking little bit action, I call it my solution to pollution. Each one of us starts taking our action. We start talking to people, talk. And then create agitation. If there are agitated people across the world, they will force the government. So it's a joint effort by people and government, which will ultimately find a solution. And solution has to be found, otherwise we won't be found.
Dr. Ruby, your quick response, and then I already have 1, 2, 3, and 4 questions.
Yeah, I just want to emphasize what Dr. Kumar has just said on this is very important, because as I have said in my talk also, and 2 days before also the same thing, but I always say, I was part of the G20 of India, when wrote the policy on climate change and One Health within the T20 TF3 task force on lifestyle for environment. And one of the things India did for the very first time of all the G20s that have happened is they had a public health person, they had a medical doctor writing it, not just economists and government people. The second thing that happened is that Think 20 actually brought together what the environment ministry was doing, what the business this thing was doing, what this thing, so all together. It was a very, and the second thing they did, which is in concert to make it actionable, they had a parliamentary P20 because the parliamentarians are one that helped to implement it to make this. But having said that, when we talk about air pollution in this thing, people say, oh, the government is not doing enough. Just like government should do this. It's this, but it's not that. Look into yourself, point towards yourself. Do you need a government like in Singapore? You do something, you're fined. You see, either you need something like that, or if you are not only made aware, even you're aware of it, you don't do it. That's the important thing. So the whole thing is to understand that we as a society collectively have to work with every other thing, and we have the responsibility with civil society more than anything else. Each one of us, not just in the boardrooms, not just in the conference venues, but just outside everywhere.
Maybe we'll take all the questions and then we'll be kind of.
Yeah, thank you so much for the wonderful presentations. So I will be starting with this. First, I'll be stating that actually to solve planetary crisis, we all know that knowledge is important. Then power also is important. Knowledge, if you are knowledgeable about a cause, you would want to take actions. And for power is actually very important. Like I would say it's mostly important because laws can be enacted for citizens to act. My country is the third most polluted country in Africa, like the third, and I think 18th in the world, which is very bad. We are currently like facing something called Niger Delta oil spillage, and it has been affecting the citizens for over 30 years now, 1968, like over 40 years. And the president is not acting, the governor of the state is not acting. People are protesting. People are dying. The water is unsafe for drinking for citizens. So in this situation whereby protest is not working, people are coming out to state. In fact, a lot of people are dying, like young children, women, vulnerable. In fact, it's not only affecting the economy, because obviously a lot of in that state, most people are into farming, are into fishing, and this is actually like affecting their source of income. So how can we force the government to act? Because I believe it's actually the government that can actually do this, not just by the citizens, because it is affecting the citizens. They know this is the problem they need to solve, but the government is not acting. How can we ensure the government acts? That's my question. Thank you.
Hey, hi. My name is Mansi. I work for local government in London, in the Health and Wellbeing Department. I just thank you for all your presentations. Mind-blowing. Dr. Arvind, you talked about how we have to create awareness because there's so little of it. I'm also interested in the commercial determinants of health. So when we talk about the big corporations, and in the Greenpeace video that we saw, it showed this Hazela who walks through and he's like, yeah, well, money can buy face masks. I don't know if this is naive of me, but I don't think any one individual is like evil like that to actually be like, I want to harm the system, and I want to harm people for my own profit. So in these organizations, in your experience of lobbying, how does that sort of narrative of like money beats everything come up? That makes sense.
Thanks, Nancy. Harjeet, and then post comments. So how do we make our governments act because citizens know what's happening, they're living it? What is the strategy of engagement and change? Who is creating that? Yeah. Harjeet?
So mine is less of a question, more of a comment, and also responding to the previous point. I think the way you have structured this panel that speaks a lot, Shweta. So we have medical fraternity, we have research, we have campaigning with solutions, we have media, we've got the movement as part of students, and of course the larger one. I think we have got all the ingredients for a successful campaign. What we need to do is to multiply our efforts and multiply our own power using all of these, from different walks of life. But at the same time, I would like to pick up on the point that Aditi made, and she's sitting here, which we always talk about, is the political economy. Yes, awareness is there, but unless we expose the political economy behind it, we will not be able to deal with the problem. So I'm agreeing, but also adding this point, that sharp focus of fossil fuel industry and politicians aligned with that and those corporate interests, I think that needs to be exposed. Yes, individual action can take, but individual action is also influenced by that political economy. I think that's what is needed. And of course, then it has to be backed by the policy framework globally, the way we are demanding for a treaty or other such frameworks for clean air and the national level implementation. I think that's what is needed in my view.
Sorry, one last comment and then panelists. Go ahead.
4 of them, they're going to have to answer so many questions. My name is Claudia. I work for the UCL Warning Research Center, so on warning systems across threats and hazards, and for the Department for Environment in the UK government. My question is, if we open our phones and I look at the air quality index, I get some information of the level of air quality and maybe some small sentence that tells me this is going to have some impact in your health. If tomorrow, I look at my phone and I could have more information, whether it's about my health, where the air pollution comes from, which at the moment doesn't say anything, what would you like it to be written in that warning systems? What information in a few lines, a few messages, would you want the phone to tell every single person about?
Okay, thank you so much for the presentation. I do appreciate it. And it's a very quick one, especially for Heng. By the way, my name is Dani and I'm coming from Indonesia, and we share the same problems and the same challenge. So thank you very much to put it everything into context, that you don't blame anyone here. But I do also believe that, and I also agree that this is need more political will from all of the individual of ASEAN member state, and also the collective action. And we understand that a lot of have been done among the ASEAN member state. But my question is, based on your experience, how do you see, how is the future of our regional efforts? For example, we also have the establishment of the ACCT HPC currently, and how do you see that? Thank you so much.
Thank you. I'm going to go back to the panelists for one last comment that I did, and I'm sorry. One last round. So thank you for your patience, the support folks over here who are trying to keep us in time. So one last round of reflections based on the comments and questions that have come up, and that's it.
Okay, may I? So I start. Okay, yeah, thank you for sharing from friends from Indonesia. Okay, how effectively the Transboundary Haze Act. So if you look at that, in Southeast Asia, Singapore has their own Transboundary Haze Act. Yeah, but because of the law they want to hold the Indonesian company account, it sent the wrong message to Indonesian government. So ASEAN's regions, they have the non-interference policy, which means that you don't interfere what I'm doing. I cannot do interfere what you're doing, which is a bit different with European unions. So the Malaysian versions of proposing the Transboundary Haze Law will be focusing on making sure Malaysian-owned company do not contributing forest fire outside other country, which means each country, each government have to regulate their own company abroad, operating abroad. That is a narrative that we want to bring in. Of course, we understand that political will and all these things are also causing problem. That also comes with I think the questions, how do we tackle it to convince governments or policymakers to make a change? So I will use a right narrative, because if we talking to the policymaker, we say like 2 or 3 people dying, sometimes they don't care. They will only care if their money or their interests are being affected. For example, the narrative that we talk to the governments are usually say, what is the economic loss and how much people are suffering because of that? And in other language, for the country we have going to have elections, we say like, if this cause of frustration among your voter, you'll be asked to step down. That is the angry that we want to, the message we want to create. And sometimes politicians, they scare about the voters. So that is the, I mean, when talk to the politician, we need to use politicians' message. When talk to businesses, we are also tell them that, hey, we are not against your industry. We are for better businesses. A lot of the fossil fuel company, they're also starting to allocate the resources to renewable energy. Why? Because they know that fossil fuel will be depleting soon and they need to generate sustainable income. So that is the message that we want. We want all this, the big company, if you look at the global system, is climate injustice. The global richest 1% cause the problem, and who suffer the most? I think all of us here, the poorest 99% here. So we need to demand climate justice. So it's time for, I think, the richest people to take back their responsibility. I think one person cannot do everything, but at least everyone can do something. Yeah, thank you.
Important messages. Our staff is really exhausted right now. So just, and please allow me 30 seconds. Quick round of comments and that's it. And we can take this conversation outside. Last words from the panelists, any one person. Salman, maybe. And that's it.
Yeah. Is it working? Okay. First of all, health is a very, very personal narrative to everyone, which needs to be, let's say, quote unquote, capitalized by us. Let's be honest with that. With regards to using an app that gives you the air quality index, we also perhaps need to explore the option of, 30 seconds is too less. I'll just complete this. Maybe exploring the possibility of listing down what are the common sources in your nearby locality that is causing this. That could spark a conversation. And yeah, I think 30 seconds are up for me.
Thank you. And I'm really sorry that I have to cut this really important conversation short over here, but we need to be respectful to our support staff who have made this happen. Thank you so much, Sunway University, and the magnificent team that just let this conversation happen so smoothly. Anybody who wants to get in touch with our panelists, I will be happy to share their email addresses. I know there are a lot of questions. We'll think about it when we go out. We will have more questions. We are happy to facilitate a conversation. Thank you so much. Thank you, everyone. And thank you. Yeah, let's take the meeting outside. Yeah, I'm going to take a picture.